So what is success? Now, if success is just getting rid of the tumor, then you go to the surgeon. They're going to cut. You'll be done by tomorrow. Okay. Is that success? No, because what do we know? What's the likelihood of it coming back all over the place? More than 80%. All right, so that's not how I would measure success. The way I consider success is this. And by the way, if you come to our center or any other center, you get IVs, and unless you go to a holistic center and you get colon hydrotherapy, you get lymphatic therapy, you get all these different things. Assuming that you get healthy, whatever your problem you came with has been resolved and you're feeling healthy. What are you taking with you that will ensure or allow you to continue being healthy the rest of your life? Well, you're not taking the IVs with you. You're not taking the colon therapy. You're not even taking the food that we made with you. You're not taking anything like that with you. What you're taking with you is who you have become and what you have learned. And that's the most important. So what I consider success is if I successfully taught you that and changed your database, your idea of things and your words and all that, successfully did that and inspired you. And I gave you the tools. I got to give you the tools to do it. I can't just say doing this is healthy. You got to develop that habit before you leave. So I need to give you the knowledge, the methodology to achieve it, and I've got to get you inspired, happy to do that, wanting to do that. And if I've been able to help you get to that point, then that's for me success, because now you have all the tools you need to live your life. Because I can't live your life. Nobody can live your husband can't, your daughter can't, nobody. You have to live it. All right. So we've given you the tools, the knowledge, and the inspiration to do it. We succeeded. Now, think about it. If someone came to our center, they do everything, and they had lung CFCs, goes away, and everything's great, they're doing well, and then a year later they start smoking again. So we can't. How are we going to measure? How are we going to put that into the formula for measuring our success? We can't. So, and what we don't realize is that smoking is mild compared to what's happening when we eat, or the exposure we're having to electromagnetic frequencies, or the exposure to heavy metals, the exposure to glyphosate, chemical, all these things that we're exposed to, right? And so we've got to give you the knowledge to know, what's going to be in your best interest and what's not going to be there, and then how to live that way. And if we can do that, then we've got a chance, okay? And not only have a chance, as long as you do it now, and you maintain that inspiration, that's the only outcome. You'd have to get struck with lightning or hit by a truck, otherwise you're going to do it. Because if you're satisfying all your biological, psychological, and spiritual needs, then your body will function optimally, and optimal functioning is the only definition of health, and that's what we're after.